We know we've got a crisis in A&E, okay? We've got a crisis with delayed discharge, we've got corridor care, we've got paramedics queuing in ambulances outside the front door of hospitals, and we have social care literally crumbling before us, okay? You could not get a worse set of circumstances, and all we get from the SNP is more of the same. What we want to do, we want to prioritise a couple of areas. We need to tackle the backlog, we need to sort primary care and give support to GPs, and we need to tackle delayed discharge because that gets the flow moving through the hospital. We do need to be bold about it. Now, the GP contract, which is the basis for all of this, we would say in our first 100 days we will renegotiate. We want people not to have to queue at 8 AM in the morning to try and get an appointment. We want to be able to guarantee that they will be seen in primary care within 48 hours. And we want to bring back that notion of a family doctor, because consistency, we know, leads to better outcomes. So all of these things we will do because we hear what patients tell us and we hear what GPs are saying. There are now 200 fewer GPs than when the SNP promised to increase them by 800. They're dealing with more patients. They are really struggling. So people end up in out of hours in A&E when they should actually be dealt with in primary care. We do need to change this because the demographics, I know it's hard to believe, we're all getting older and we're not necessarily healthier. So we need to change that dynamic, and the way you do it is by ensuring that there is reform and investment in primary care. In addition to that, we are going to reduce the number of health boards because there's too much bureaucracy, and we're going to put clinicians in charge because they feel completely distant from the service that they're operating in. We need them to be talking directly to ministers so we can turn the thing around. Okay.